This is our business analytics project. I'm Charli.
And I'm Blair.
These are the questions we use to gather our data. So 1, how does timeliness of care relate to complications? And number 2, how does timeliness of care relate to demographics?
On this slide, we included 3 different boxes that shows the 3 different variables that we used. So we related hospital demographics to timeliness of care, and then patient complications to timeliness of care. Within each box, we also listed the 5 different variables that we used to help collect our data throughout this experiment.
So for our hypothesis, we said if the percentage of patients who left the emergency department before being seen by a physician increased, then safety complications will also increase. This is because patients will not be healthy and can cause harm to themselves or other people. Their problems for going to the emergency room may also worsen and cause them to become ill.
Okay, so on this graph, we're looking at the 2 bar graphs that we got to examine our data, and this is for safety complications. So we had 2 bar graphs because there were outliers in the data. So in order to make the data more representative of the average hospital in the United States, and to make the data cleaner for statistics purposes, making a bar graph without outliers was most appropriate. So in the bar graph without outliers, it stops at 1.92, and in the bar graph with outliers, it stops at 4.27. On this slide, we included the bar graph for the percentage of patients who left the emergency department without being seen by a physician. There was only 1 bar graph because there were no outliers in the data. So looking at this bar graph, you can see that the chart stops at 12.9. In this slide, we included one of the bivariate graphs, and this graph compares patient safety complications to the percentage of patients who left the emergency department before being seen by a physician. And looking at this scatter plot, you can tell that the 2 variables have a positive relationship because the line is going up instead of down. So this means that when the percentage of patients who left the emergency department before being seen by a physician increases, then the number of patient safety complications also increases. On this slide, this includes the linear regression for our hypothesis. So there are a number of different things we can look at for this linear regression. The first one is the number of observations used, which is 2,947. So that means it's okay to use that number since it's above 2,000. The next thing that we can look at is the p-value. If it is below 0.05, then that also means it helps support our hypothesis. So in this case, the p-value is 0.001. Next, we can look at the R-square value, which is the percentage of the variance that can be accounted for. So this R-square value is 0.06 or 6.4%, which means it's also okay to use because the normal range for an R-square value is 0.05 to 0.15. And then lastly, we look at the constant variables that are listed in the parameter estimates, and there are some variables that have a p-value of greater than 0.05, which we cannot use those to help support our hypothesis, but we can use the ones that are less than 0.05. So if you're looking at the variable QTOP22, that means for every patient that leaves the emergency department before being seen by a physician, that increases the safety complications by 0.007.
So on this slide, we're going to talk about the policy that we implemented. So kind of our purpose or scope that we are going to follow is the expectation of the amount of time a patient should wait in the emergency department. So the policy applies to all staff members of the emergency department. And kind of some responsibilities and kind of like the review cycle of this policy are the managers of the emergency department and the vice president of operations. They can review the document each year and kind of give their input, and along with current staff members, they can also give their input as well. So the policy itself we have on this slide. So number 1, a patient must be seen within 45 minutes after checking in and filling out paperwork. So they can be seen by any kind of licensed medical staff. That can include a nurse practitioner, a physician's assistant, or MD. So if the staff members are unable to meet the expectations that have been laid out for them, they will be discharged or therefore terminated upon their next violation of the policy. So number 2, there must be at least one certified nursing assistant, one nurse, one doctor, and one surgeon on call at all times in case of a shortage of staff members in the emergency department. And then lastly, number 3, staff members must follow the implemented procedure of checking patients and examining them. And so a couple things like to monitor this procedure, or how we're going to monitor this procedure is 1, the emergency department managers should provide a semi-annual report to the vice president of operations, kind of showing the amount of time a patient waits in a hospital before being seen by a licensed staff member. 2, like a staff member also could report a semi-annual questionnaire, kind of giving their opinions on how they think the flow of the emergency department is and how the policy is working after it was implemented. And then 3, like also patients can fill out kind of like an end-of-visit survey stating how long they waited to be seen, and also kind of give a little bit of information on how their visit went. On this slide, we're going to be talking about our experiment that we conducted. So for our experiment, we implemented a policy about improving the amount of time patients wait to be seen by a physician in the emergency department. And so with this experiment, it reduced the number of patients who left the emergency room before being seen by a physician, and also reduced the number of patient safety complications caused by long waiting times. And so for our experiment, the policy was implemented for 90 days to see if there was improvement within the waiting rooms in the emergency department. There was actually immediate change in the waiting time since there was a time limit set within our policy. And so after our experiment, patients received surveys based on their experience in the emergency department and how long their waiting time was before they got to be seen by a physician. And so these surveys will help conclude if our policy was effective or ineffective. So on this slide, we're going to talk about our conclusion. So the data analysis and experiment for both concluded that our hypothesis was correct and that patient safety complications would decrease if the amount of patients who left the emergency room before being seen by a physician decreased. So the policy was effective and helped solve functioning issues within the emergency department, as well as lessen the amount of time patients had to wait to be seen by a physician. So this comes to the end of our presentation. Thank you for listening.